Well, hi, good afternoon. It's nice to see everybody towards the end of the show here. As a method of brief introduction, my background, as was already said, I practice community-based internal medicine, traditional internal medicine, inpatient and outpatient. I also do a lot, obviously, with nutritional cleansing and schooling, University of Miami, School of Medicine. I graduated in 1985. I trained my internship and residency at Mount Sinai, and I'm board certified in internal medicine. So with that, we're going to discuss very briefly in 30 minutes a nutrition program that I've utilized in my practice and the clinical results that I've seen with the patients. Now, the key that brought me to this was obesity with the patients and obesity as a comorbidity for most chronic diseases. Literature tells us that reducing body fat will improve our overall health and reduce the concomitant effects of the various diseases we have up there. Cardiovascular disease being number one, but of course kidney disease, obesity carries a major risk factor, as does diabetes and the potential for metabolic syndrome associated with just insulin resistance, COPD and asthma, and a couple of others which I hadn't added up there happens to be congestive heart failure. So, if I can rewind to 2009, there was an article in Newsweek that spoke about leptin. Those of you not familiar with what leptin is, it's a hormone that's been identified in the fat cell, and it's released by the fat cell to signal to the body that we have enough food or energy reserves so we can stop eating. It's a trigger mechanism, a negative feedback. When there's a deficiency in leptin, we tend to eat more. And that's what's now being theorized as to why we have obese individuals who are otherwise healthy and don't have any of the above diseases that you see. There was a child in England in the early part of 2000 when this was initially identified. He was found to be leptin deficient completely. At the age of 6, he was more than 250 pounds. Now, he received injections of leptin much in the same way as a diabetic receives injections of insulin. The child's appetite returned to normal. He was no longer overeating, and he lost the weight in a very quick manner, which raised the question now, can hormones be used to manipulate obesity? In 2008, the American College of Cardiology had a symposium which was entitled Nutritional Supplementation Utilizing Amino Acids in Coronary Artery Disease and Cardiovascular Disease, as well as metabolic diseases such as diabetes. It was published in the journal, or actually the American Journal of Cardiology, also known as the White Journal, and that's what a good deal of my references are drawn from. So if you want any additional information regarding that, the bibliography to today, you can find the reference and you can pull it yourself off the internet. But in any event, what was shown and what is talked about is that with proper nutrition, through an anabolic type of a nutrition program, with detoxification and cellular cleansing at the microscopic level, specifically at the level of the cell, we can mobilize body fat at a higher rate than what's once been taught or believed, where we would speak of reducing, for example, 3,500 calories per day, or 3,500 calories per week would equate to 1 pound of fat loss per week. But with what I'm going to show you, I've been finding on average 3 to 5 pounds of fat loss on a weekly basis. And that's felt due to the simple fact that under the electron microscope, there's been shown sarcopenia, meaning loss of volume of the sarcomere, the muscle fiber, in the obese individual, in the elderly individual. If there's a way to improve the number or the size of the sarcomere, volumize it, then we can improve the metabolic function of the sarcomere in fat metabolism. What was also shown with proper nutrition in an anabolic diet with an increase in essential amino acids, so basically eating complete proteins, that the mitochondria, which is the organelle, the power center in the cell, increases in number. That was landmark information because it's inside the mitochondria where fat burning occurs. From the biochemistry standpoint, the inner membrane is where the carnitine palmitoyl shunt is located. That's where fat burning occurs, so it stood to reason that if we could increase the number of organelles inside the cell that burn fat, that we could actually burn more fat at the gross level looking at the person. And that's again why we believe through this type of a nutrition program we're able to lose more fat and improve health.